Hello, and welcome to the session, The Start of Labor. In this session, we will discuss the following subjects: understanding the start of labor, recognizing the start of labor, and understanding and managing pain. First, let us review a few notions of anatomy of the future mother. The uterus is a muscular organ that grows in size as the pregnancy progresses. This is where your baby develops. The cervix is the bottom part of the uterus that links the vagina and the uterus. The bladder is an organ that holds the urine produced by the kidneys. The vagina is a roughly 8 cm long passageway between the uterus and the vulva. The vagina is flexible and elastic so it can stretch during delivery. Contractions of the uterus allow the cervix to become thinner, effacement, and open, dilation, until it is 10 cm wide. The dilation of the cervix is calculated in centimeters, and the effacement in percentage. This is measured by the physician through a pelvic examination during medical follow-ups starting at 36 weeks, and again by the physician and nurses during labor to evaluate the progress. In the first picture, the cervix shows no dilation and no effacement. In the second picture, the cervix shows a 1 cm dilation and 75% effacement. In the last picture, the dilation is complete at 10 centimeters and effacement is complete. The baby is now ready to come. Stations describe how far the baby's head has descended through the pelvis. In general, a fixed head does not move back up the uterus, corresponds to station 0. Approximately 1 in 10 women will have the breaking of the waters, the rupture of the amniotic membrane. This signals the start of labor. You may only lose a few drops, but you may also lose enough to wet your bed or your clothes. The liquid you lose is generally as clear as water, but it may sometimes contain small amounts of blood. At the end of the pregnancy, it can sometimes be difficult to distinguish amniotic fluid from normal vaginal discharges, which increases during this period. If you are not sure, a simple test during a maternity consultation will clarify the situation. What to do if your water spontaneously breaks? Note the time, amount, and color. This information will be useful to the nursing staff. You can also call the maternity ward to inform them that you are coming. Lay down for about 20 minutes. Among other things, this helps prevent umbilical cord prolapse. Umbilical cord prolapse is when the umbilical cord is positioned between the baby's head and the cervix. Clean yourself up, but avoid taking a bath, because now that the membranes are broken, your baby could be exposed to the bacteria or other agents found in bath water. It is better to clean yourself in the shower or using a washcloth. Go to the hospital. Go to the hospital calmly, respecting the road safety rules. It is better to delay the moment when you leave for the hospital ward as much as possible. This reduces the possibility of interventions and increases the future parent's comfort. The early phase of labor can be long and will be described in more detail in the session about the labor and delivery. By staying home, you keep a greater peace of mind by focusing on enjoyable activities. Continue sleeping, eating, and resting to have all the energy that you will need later. Use the 5-1-1 rule to determine if you need to go to the hospital. When the contractions become more painful, happen every 5 minutes, last 1 minute long, and have been happening that way for at least 1 hour, it is time to leave for the hospital calmly, respecting the road safety rules. When you get to the maternity ward, an evaluation of the labor will be done, and women whose cervix that is not dilated at 4 centimeters could be suggested to return home. The hormone known as oxytocin plays a role in the start of labor and in the intensity and frequency of uterine contractions. The objective of the contractions is to push the baby down to efface and dilate the cervix. During the contractions, your belly tightens and becomes hard. The first contractions can sometimes feel like menstrual cramps. The pain lasts about 20 seconds. Many women feel the contraction pain in the lower abdomen. For others, the pain is located in the lower back and extends to the front. Some women will feel contractions before the start of active labor. These contractions can be painful and regular, and last for some time, leading the woman to believe that the labor has started. However, the effacement and dilation of the cervix, two characteristics of active labor, are absent during preparatory labor. Rest, take a bath, and if the contractions stop, this is a sign of what is called false labor. When the labor is effective, the contractions usually get longer and more intense, and the time between contractions will shorten. When we talk about having contractions every 10 minutes or every 5 minutes, we are talking about the time between contractions. This is measured as the time between the start of one contraction and the start of the next contraction. For example, if one contraction starts at 9 and then the next one starts at 9:10, we will say that your contractions are 10 minutes apart. The pain in childbirth is unique and has a meaning. It is an integral part of the delivery. It signals that the labor is active. Instinctively, that feeling of pain sends a message to the mother so that she can prepare to give birth. The pain felt during childbirth is different from the pain or suffering caused by a trauma. During childbirth, the pain can coexist with satisfaction, joy, and empowerment. You have everything you need within yourself to overcome that pain. The time between contractions can help you recover. The pain is mainly caused by the uterine contractions, progressively opening the cervix. This pain means that the uterine muscle is working and making an effort. Sometimes a sharper pain can be felt in the form of cramps or colic caused by the dilation of the cervix. The pain can be even more generalized or felt in the back or the legs. This is normal because your uterus is now so large that even the slightest stimulation can have repercussions on the whole body. Sometimes the pressure of the baby's head that is exerting on the pelvis can increase that sensation. Later, when you are pushing, you may feel a burning or stinging sensation. This is due to the pudendal nerve stimulation near the vagina, when the perineum is totally extended. This sensation does not mean that there is a tearing. The pain stimulates the production of endorphins, which plays an important role in the flow of hormones released to make natural delivery easier. The pain and the complex interaction between hormones favor the establishment of the behaviors necessary to breastfeed and take care of your baby. Understanding the pain will help you better deal with it. Pain is an ally to help advance the labor and give birth to the baby. There is an intrinsic relation between pain and fear. The more the woman is confident, the less stress she will feel, which will lead to a series of reactions that will make the delivery easier. Endorphins are released as a response to pain. High levels of endorphins help women better deal with pain. Inversely, if the woman feels panic or lacks control, she will feel more stress. A very different series of reactions is then put in motion. Adrenaline interferes with the production of oxytocin and the effects of endorphins. The feeling of being in control is linked with a positive experience of childbirth. As mentioned in the session about preparing for childbirth, being well prepared will help you remain positive and in control. On the other hand, giving birth requires that the woman let go, reconnect with her instinct, and let her body do the work. Oxytocin plays a part in the start of labor, but also in the advancement of labor. The progressive increase in oxytocin level makes the contractions last longer and reduces the time between them. Its production can easily be altered by external factors. Oxytocin is also called the love hormone because apart from its effects on breastfeeding and uterine contractions, it plays an essential role in the establishment of a protective bond between the mother and her baby. This hormone regulates a whole set of reactions dedicated to the bond and attachment. It reduces anxiety, gives a feeling of security, and favors confidence. Oxytocin and endorphins work together to make childbirth easier. However, a few elements could disrupt and interfere with this physiological process. Disrupting factors: noise, lights, fear and anxiety, feeling watched, getting asked questions, certain types of examinations. Enhancing factors: feeling confident, darkness, water, the presence of significant people, and freedom of movements. For any questions regarding the content of these prenatal capsules, you can contact your region's perinatality nurse.